The biggest misconception about facelift recovery is thinking you'll look completely normal in 2 weeks. That expectation creates unnecessary anxiety. Most patients aren't afraid of the surgery itself. They're wondering, what will I look like afterward? When can I go back to normal life? When can I be seen in public? And what's normal versus what should worry me? So today I'm going to walk you through a realistic, honest recovery timeline for the first 14 days. And I'll also tell you what surprises people, what I reassure patients about most often, and how to think about the healing process in a way that reduces stress. Recovery is a process, not an event. The first thing to understand, a facelift recovery has two timelines happening at the same time. There's the social timeline, when you feel comfortable being seen, and there's the biologic timeline, when swelling truly settles and tissues are fully softened. Those are not the same. 2 weeks is often socially presentable, in fact 10 days are, but it is not fully healed. Days 0 to 3, the peak swelling window. Right after surgery, your body does what it's designed to do. It creates inflammation. Swelling is part of healing. In most patients, swelling typically peaks around day 2 to day 3. That surprises people. Patients often tell me, I didn't expect day 3 to look puffier than day 1. That's normal. What you usually feel is tightness, pressure, a sense of firmness. It's not usually sharp pain. It's more like a tight garment feeling. Tightness is normal. It doesn't mean something is wrong. What you usually see, swelling around the jawline and neck, cheeks, a little bit of bruising, sometimes a lumpy or even uneven look from swelling. Here's an important reassurance I give patients. Early swelling can look uneven. That's normal and temporary. As we move to days 4 to 7, things start turning the corner. This is when people begin to feel relief. Swelling begins to come down gradually. Bruising, if there is any, starts to change color, a little bit yellowish discoloration, and it begins to fade. Most patients start saying, okay, I can see this is going in the right direction. That's a good feeling. This is also when patients start asking, when can I wash my hair? When can I walk more? When can I drive? Those answers vary depending on the exact procedure and how you're healing, but in general, activities increase steadily. In fact, many of those things you can begin to do day 1. Here's the key point. Week 1 is about healing safely, not judging the result. Week 2, days 8 to 14, you're improving but still healing. Week 2 is often the hopeful week. Many patients look significantly better than they did in week 1. As I mentioned, bruising is fading, makeup can help, hair can help for women who have hair, men as well. Swelling is still present, but it's softer. Here's what I tell patients to expect. You may feel public ready with hair and makeup. You may still feel tight, numb, and firm in areas. You may still see swelling, and you might notice that more than anyone else notices. You feel it more when you're smiling or engaging. At 2 weeks, you are not fully healed, and that's normal. This is the moment I remind patients. Your friends and coworkers may say you look great, and you may still look in the mirror and notice swelling. Both can be true. You notice the swelling more than anyone else does. The most common normal worries patients have. Let me go through the top things patients ask me in the first 2 weeks. My swelling looks uneven. That's normal early on. I feel numbness. Very common. The nerves need time. It may be 4 to 6 months. What transitions is it goes from this dull, woody feeling in the first week or two to a feeling that is a little bit numb. If I see you back 3 months later, I'll ask, how's the numbness? You'll feel around a certain area. There's still some numbness, but that continues to improve and eventually dissipates. I feel tight. Normal as tissues settle and swelling changes. In fact, many patients haven't the idea to stretch their jaw. If you have a tight muscle you want to stretch, feels good. We don't want you doing that, and we remind you a dozen times not to stretch your jaw. And the reason for that is we've tightened that smaz, we've tightened that deeper layer. We don't want you to undo that unnecessarily by showing off how well your jaw is opening. The next one, my bruising looks intense. Bruising varies person to person, medication use, and how your body responds. Generally speaking, with the local anesthesia, we use the lidocaine with epinephrine. We lose very little blood during the procedure, maybe 2 teaspoons. We don't use tubes or drains. We haven't in 25 years. However, there's always a little bit of blood under the tissue, and you may see a little bit of yellowish discoloration, and it usually moves from the jawline down into the neck area as the days and weeks proceed. Generally speaking, bruising is not significant. Most early recovery concerns are normal variations of healing. What would actually be concerning? I also like to be clear that there are things that warrant immediate attention, and we guide patients on exactly what those are. But for most people, recovery is very predictable. I'm not trying to minimize it, I'm trying to make it less mysterious. Why some people heal faster than others? Patients sometimes compare themselves to others online, and they think they're behind. In fact, I think always, even when I underwent my eyelid surgery, I thought to myself, oh my gosh, I tell patients this every day, but it does take time. You always think you're further behind than you should be. It's just the way we are. But it's not fair to yourself to compare much to others. We give you videos ahead of time. Patients have been kind enough to provide their day-by-day recoveries, and those are very helpful. You'll see people all over the spectrum, but it's really honest. Healing depends on skin thickness, bruising tendency, blood pressure, nicotine exposure, medication, supplements, how much you rest and follow instructions, hydration, etc. Comparing your recovery to someone else's timeline is a mistake. When do you see the real result? This is where patients benefit from honest expectation. You'll see meaningful improvement within weeks, and you really can start to see where things are going. You'll look more normal around 3 to 6 weeks, where you're starting to really own the result, and you can see the confidence in patients. You'll see refinement continue all the way through 3 months, 4 months, 5 months, and subtle maturation can continue beyond that. The result refines for months, not days. A quick patient example. I'll give you a realistic example. A patient in her early 50s told me at day 10, I'm worried people will stare. By week 3, she said, I can't believe I was worried. I look like myself again. That's common. The emotional part of healing often peaks before the physical swelling is gone. The emotional recovery is real, and it gets better. If you're traveling for surgery, for out-of-town patients, we plan recovery carefully. We make sure you have clear instructions, proper follow-up planning, and a safe travel timeline. Many of our patients travel to Cincinnati, and we make the process very organized with detailed recovery planning. If you're considering surgery and recovery is your biggest hesitation, that's completely normal. A clear plan reduces anxiety, and it starts with an evaluation. We offer both in-person and virtual consultations for patients nationwide. If you want to know what recovery would look like for you, that's exactly what we discuss in consultation.